Welcome to the Medical Reserve Corps. We're honored that you've chosen to join the MRC, and we want you to feel welcome and informed as a new volunteer. This orientation will take about 15 minutes. This video is one of the several training modules you may need to complete so that you are prepared as a new volunteer. Check with your local unit lead to make sure you know what training is required. After you complete this orientation, you will know more about the history, purpose, and structure of the MRC, including types of deployments, types of locations where you might be deployed, possible roles you may perform, and you will learn about our general code of conduct, as well as information about liability coverage for volunteers. So let's get started. The Medical Reserve Corps is a network of volunteers across the United States, organized into local units. These units work to strengthen public health and are as unique as the communities they serve. Specifically, MRCs focus on being prepared to respond to emergencies, support communities in recovery, and foster resilience. The National MRC Network is made up of hundreds of thousands of volunteers and hundreds of units. Volunteers include current and retired medical professionals, mental health providers, and others with a clinical licensure. They are joined by community members of many disciplines and talents, and all work together to provide valuable support in disasters and times of emergency. They also participate in preparedness and prevention work, like facilitating health fairs, health screenings, blood drives, and vaccination clinics. After the attacks on September 11, 2001, the administration of President George W. Bush established a demonstration project creating locally based volunteer units to respond to disasters. When most people were running away from the World Trade Center, some were running toward it, knowing that many people needed help, more than first responders could handle. These brave folks were healthcare workers, nurses, doctors, paramedics, and many other trained professionals. But there was no way to verify their credentials on the scene, and they were turned away. This led the federal government to develop a program whereby they could verify credentials, assess skills, and properly train volunteers prior to emergencies, to ensure appropriate scope of practice and more effective emergency responses. This new initiative eventually became known as the Medical Reserve Corps. Now, this name is a bit of a misnomer, considering that many Medical Reserve Corps volunteers do not have current or prior clinical licensure, but are still critical to our mission, providing key infrastructure and logistical support. Non-medical volunteers make sure that supplies and equipment are in the right place at the right time. They provide friendly faces that greet clients and help them find their way around a site. They provide psychological first aid to ensure that clients feel safe and comfortable amidst what is likely a chaotic or even scary experience. Everyone at the MRC works together to improve the overall health and safety of our communities, especially for those who are often disproportionately impacted by public health emergencies. MRCs are run at a local level with state support. State coordinators collaborate with the regional liaisons and unit leaders at a local level, as well as state-level partners. They may provide high-level support through access to volunteer management systems, training, and funding opportunities. At the local level, each MRC unit is led by a unit leader and/or coordinator who matches community needs for emergency medical response and public health initiatives with volunteer capabilities. Local coordinators are also responsible for building partnerships, ensuring the sustainability of their local unit, and managing volunteer resources. For more detailed information, click on the network profile link below. Here in Minnesota, we have a robust history of community service and support demonstrated by early and eager engagement in the MRC program across the state. Since the first Minnesota MRC unit was founded at the University of Minnesota in 2004, the state has continued to build up capacity to respond and support resilience in our diverse communities. Over the years, Minnesota MRC units have responded to floods and tornadoes, pandemics, and even veterinary emergencies. The Minnesota MRC units have provided disaster behavioral health support to communities impacted by events such as community violence, explosions, refugee resettlement, and structural emergencies like the I-35W bridge collapse. Units have conducted training on skills such as first aid, stop the bleed, CPR, and naloxone administration. They have practiced responses to a radiation emergency, infrastructure damage, and mass casualty incidents. They have prepared with partners in healthcare to support hospitals, clinics, and long-term care facilities. Minnesota is fortunate to have over 20 units across the state. These are mostly based in local public health departments, but span cities, suburbs, and rural areas. Additionally, there is a unit at the University of Minnesota, as well as statewide units, one specifically focused on disaster behavioral health and one dedicated to veterinary medicine. The MRC is focused on the future with our connection to the state's HOSA chapter, who help develop younger students who are interested in becoming health professionals. Altogether, Minnesota has thousands of MRC volunteers spread across the entire state. Your fellow volunteers vary in age, profession, gender, languages spoken, and share a passion for making a difference. We are students and retirees, nurses, doctors, public health professionals, scientists, teachers, and dedicated community members with and without medical or clinical backgrounds. Eligibility varies unit to unit, and we are working hard to diversify our MRC volunteer pool in order to better serve everyone in our state. So, spread the word that we'd love to have our MRC units filled with more representation in countries of origin and languages spoken. So now you know, MRC units recruit, train, and activate medical and public health professionals, as well as other volunteers to respond to community health needs during disasters and other public health emergencies. But what does that mean for types of activities you might participate in as a volunteer? While further trainings will dive into specifics, some examples of activities that MRC volunteers participate in and support include the following: trainings and exercises to practice emergency response skills, disaster, medical, and behavioral health support, mass dispensing efforts of water, supplies, medication, and more, disease testing and surveillance. Or sometimes it could be vaccination clinics, family assistance centers, and support services after a disaster. Or maybe something like answering phones for a hotline, or to conduct case investigation and contact tracing, or first aid and basic medical support during large public gatherings or community health promotion events and outreach. There are roles for MRC volunteers in both emergency and non-emergency situations. Regardless of the type of activation, remember that you are never required to respond, and we will not expect you to abandon your job or personal commitments. Given these and other potential activities for volunteers, it's possible that you could find yourself working in many different types of locations. Sometimes these could be smaller indoor spaces that the local health department uses for training or administrative support. But it is also possible to find yourself in larger family assistance centers or larger buildings for medication distribution or vaccination clinics. These could be schools, churches, community centers, or conference centers. During pandemics, MRC volunteers make sure that community members can move smoothly and quickly through testing or vaccination sites. You may also work outside at a drive-through vaccine clinic or a vehicle decontamination area during a radiation incident. It may also be at a park or large outdoor space doing community education or helping with post-disaster cleanup. Although out-of-state deployments are less frequent, Now that there are more MRC units and other infrastructure to support local responders, there is always a possibility that your unit could be requested to support another jurisdiction. In those cases, your unit leaders will communicate the policies and procedures for that specific deployment. Wherever you find yourself on possible deployments, your MRC leadership will make sure that you are told what is most appropriate to wear and any precautions that may be needed to keep you safe and healthy, and they will provide you with additional equipment or supplies such as brightly colored vests or communications materials. Our MRC volunteers are an invaluable asset to our communities, and our number one priority is your safety. In order to ensure the safety of all MRC volunteers in a response, there are various things that unit leaders are responsible to ensure. And there are also things that individual volunteers commit to through a code of conduct. Each unit may have a different code of conduct they require their volunteers to follow, but all likely have similar expectations for MRC members. Professionalism is required at all times when in uniform and/or when associated with MRC activities. Practice good hygiene, avoid offensive language, and respect the public and coworkers. Inappropriate behavior, including harassment, is strictly prohibited. Obey all laws practiced within the guidelines of the medical protocols established. Follow directions given by authorities on the scene, incident commander, public safety, fire department, EMS, healthcare, and public health officials. Be responsible for maintaining the confidentiality of all proprietary or privileged information for volunteers, clients, or any other people with whom you may interact. Do not discuss information regarding a patient with anyone, except those with a specific need to know, such as EMS or hospital staff and public health officials. Members must not use, possess, or be under the influence of alcohol or drugs at any time while serving. Members are required to perform their duties in a safe and prudent manner and never intentionally place themselves or others in a dangerous situation. Unit leaders are responsible to communicate the legal liability coverage that applies to volunteers in both times of emergency and non-emergency. Different localities are subject to different legal liability laws and standards. Because the rules and laws vary, it is not possible for the MRC Program Office to provide information applicable to all 50 states and to all jurisdictions. State offices may provide information about their individual or their regional liability rules. Some states offer greater protection to medical volunteers than others. Additionally, some response partners may be able to extend the liability and workers' compensation privileges that normally apply to regular workers. State and federal statutes generally protect health and medical volunteers from personal liability, provided if they are acting within the scope of assigned responsibilities, properly licensed, certified, or authorized by appropriate authorities to perform assigned responsibilities, performing activities in good faith within the scope of their assignment, registered with, deployed by, and under the direction and control of a political subdivision, not intentionally or willfully harming anyone or engaging in criminal conduct, and are not engaging in wanton neglect of people or your duty, reckless misconduct, or a conscious and flagrant indifference to the rights or safety of anyone associated with the MRC or persons who may have been harmed. We hope that you find your service to your community personally fulfilling, learning and networking or meeting new friends who take pride in working toward a common goal that benefits society. Your time and efforts are greatly appreciated, whether you are deployed in your local area, elsewhere in the state, or as part of a larger national response. The impact you will have is beyond measure. We absolutely could not do this critical work without you. Thank you.